I always wanted to be a doctor, never wanted to be a cowboy or a policeman or anything like that. I always wanted to be a doctor. I don't know, just predestined, I guess. I can't think of it ever wanting to be anything else. One of my best stories is that I was an intern at Baptist Hospital July 1, and the first patient I picked up was a gentleman that had colon cancer. And so I said, well, hot dog intern, I'll go call the attending. That was Bill West. And we started, my first day as a doctor and doing anything, I met Bill West, and I've been with him ever since. So it's been really such a wonderful relationship. He's been a great mentor to me. Cancer is one of those things where the technology is critically important, but it's really the hands-on. You're right down at right at the crux of where they are, you know, and they're talking about their own mortality, and so you have to be aware of that, and you can't just talk science to them. You need to talk a little bit of humanity to them as well, and let them know it's okay to cry, let them know that it's okay to be mad, you know, let them try to get through this, because there's more than just getting chemo or getting radiation or now getting immune therapy. It's just a lot more than just that. It's just such an incredible responsibility and honor to take care of patients. You know, I take care of them with cancer, and that's in the crisis of their life. And to be involved with somebody in that situation is just such an honor, and you just need to treat it that way. You need to remember that it's about them, not about you. And you also need to remember that everybody has their own way of doing things, and you need to listen to people when they're talking to you rather than hearing what you want to hear, because they'll tell you. It's just such a wonderful thing. I mean, we see a lot of people pass away, but we help them do that. You know, we help them do that as comfortably as possible, and we're curing a lot more people now than we ever did before, which is wonderful. But it's still a very difficult thing, and it's just very humbling to be able to do that. Getting to physicians is very difficult, and Memphis Medical Society helps that. They help coordinate that and get patients to who they need to see, and help patients who can't get there. Help them with a lot of different programs, rides and everything else. And I think that's very important to sort of show society that the physicians are really interested in you, and that's what the Medical Memphis Society presents to Memphis is, we're here for you and we want to help. It's incredibly humbling. You know, there are so many people that do such a great job, and so many physicians that do such a great job. To be picked out of the crowd is really very humbling and undeserved, but I'll take it. But it's really very nice, very nice. And to get this honor now is really, really a culmination for me, but it really wasn't about me. We had a volunteer luncheon today, and I told the volunteers that I was coming tonight, and I explained to them it was really about them. You know, because I was at the West Clinic, and people knew about the West Clinic, and the West Clinic, the heart and soul of that are the people at the West Clinic, the people that we're kind of almost evangelical. You either work at the West Clinic for 2 weeks or for 20 years. You know, you find out right away whether you can do it, and that's what's propelled me, been able to have a lot of my success, is all these people behind me, and I'm very grateful for that, because I've been able to do a lot more than I would have been able to do on my own.